You're watching Talk with Audrey. Welcome back. Manhattan's Community Nine's chair of the Health and Environment Committee, Laquita Henry, reached out to me to help them raise awareness, dispel myths, and foster a supportive community for those affected by sickle cell disease. The Health and Environment Committee plays a vital role in monitoring and addressing the social determinants of health within the community, and they also nurture a healthier, more sustainable West Harlem. As a resident of New York City and the community of Harlem, coupled with my commitment to provide information every week to help people improve the quality of their life, well, you know me, I had to dive in. And I'd like to thank her and the chairman of the Community Board 9, Victor Edwards, and District Manager Yutha Prince for working with me to present a series of interviews with doctors and a survivor of sickle cell disease. You're going to meet Dr. Cheryl Mensah, Assistant Professor and Co-Chair of the Sickle Cell Research Work Group and a Hematology and Oncology Specialist at Northwell Hofstra Zucker School of Medicine and attending at Phelps Memorial Hospital. You'll meet Dr. Susanna Curtis, Assistant Professor of Medicine at the Icahn School of Medicine and Assistant Director of the Adult Sickle Cell Program at Mount Sinai Hospital. And sickle cell patient Montez Davidson and her daughter Kasara shared their journey. Did you know that according to the National Institute of Health's National Heart, Lung, and Blood Institute, sickle cell disease is the most common form of inherited blood disorder and affects more than 100,000 people in the U.S. and 20 million people worldwide? Joining me now, my first guest, Dr. Cheryl Mensah, Assistant Professor and Co-Chair of the Sickle Cell Research Work Group and a Hematology and Oncology Specialist at Northwell Hofstra Zucker School of Medicine and attending at Phelps Memorial Hospital. Welcome. Dr. Mensah, who's at risk and what are some of the signs and symptoms of sickle cell?
So sickle cell disease is a blood disorder that affects the red blood cell. In sickle cell, it causes the red blood cells to change shape, to block the blood vessels, and prevent oxygen from being delivered. And this can cause some patients to have symptoms such as pain. The most common or the hallmark of sickle cell disease is having a pain crisis that can cause patients to go to the ER or to the hospital. The people who are at risk for sickle cell disease, it can affect people of all backgrounds, but it's most common in people of African descent. Sickle cell disease is actually most common in people from West Africa, but can affect people from the Caribbean and African Americans. Um, it can also affect patients who are Hispanic and Caucasians more rarely, but still can be affected by sickle cell disease.
And so it's not a very common trait, but everyone seems to think that it's just African Americans who are impacted. And what I've just heard you say is that that isn't the case at all.
Originally, people with West African descent, there was sickle cell as an evolutionary condition to help protect people from malaria. And so it affected people mostly in areas where malaria was prevalent, like in Africa. However, as centuries have gone by, and people have migrated from continents and intermarriage and other things of life, we see sickle cell disease in people of Hispanic descent, people of Caucasian descent, especially Italians, like Southern Italian, and even in the Middle East, in India, there's sickle cell there also. So anybody can get sickle cell disease. It's just a matter of who your parents and grandparents and descendants are. But it can affect anyone.
And are there variations of sickle cell disease?
The most common is we call it hemoglobin SS. And so, within our red blood cells, we have hemoglobin. That's what carries oxygen. And regular hemoglobin is called hemoglobin A. Sickle cell hemoglobin is called hemoglobin S. Patients with SS disease, about more than 90% of their blood is sickled hemoglobin. So these are cells that change shape and don't deliver oxygen as well as they should. But there are other types that are more milder, such as sickle thalassemia, sickle beta thalassemia. Thalassemia is another blood disorder that affects people, actually more commonly people of Mediterranean descent, like Italian and Greek, but also African American. And sickle beta thalassemia can be a milder version of sickle cell disease. Same with hemoglobin SC disease. Um, C is another type of hemoglobin. And so there's SF, which is the most severe. There's sickle beta thalassemia, hemoglobin SC, and those are the three most common types. But there are a lot of other types, even beyond those three. There's a whole category of blood disorders called hemoglobinopathies. And these are basically where you have different types of hemoglobin, but any of those paired with hemoglobin S can also cause sickle cell disease.
Well, Dr. Mensah, how is sickle cell diagnosed?
Sickle cell disease is diagnosed at birth. So when a baby is born, they do a heel stick and they send off the blood to the lab and they look for sickle cells within the blood. For parents who have a baby with sickle cell disease, they will usually receive a letter from the hospital saying that the baby has a red blood cell disorder. Then they will send a letter to the hematology office that is affiliated with that hospital for a first-time appointment with the parents and the baby and the hematologist. For people who are born outside of New York or outside the United States, if they're adults, they do another test called hemoglobin electrophoresis. In this test, they look for sickle cells in the blood. If you have over 50% of the blood with sickle red blood cells, that is sickle cell disease. If you have less than 50%, that is sickle cell trait.
What complications might someone with sickle cell experience?
So sickle cell disease can affect every organ. The most common complication is a pain crisis, and that's when the sickle cells block the blood vessels, and that blockage causes a lack of oxygen to be delivered, and that can cause pain to the patient. So that can affect them in their joints. They can have, hip pain, shoulder pain. It can affect their lungs. It can cause a condition called acute chest syndrome, which causes a patient to be hospitalized, have difficulty breathing, and require antibiotics, fluids, and even a blood transfusion. It can cause patients to have a stroke. Patients could have strokes with sickle cell disease, and a stroke in sickle cell does not present in the same way as a stroke with a patient, with high blood pressure, for example, because sickle cell affects patients who are younger, so they have different manifestations. Sickle cell can also affect the eyes and cause vision changes. It can affect the kidney and cause kidney disease. And so there are almost every organ can be affected by sickle cell disease, and patients can have complications anywhere, head to toe, from sickle cell disease.
So I understand that one of the complications is a pain crisis.
A pain crisis is when, during times of stress, the red blood cells change shape and they block the blood vessels. By blocking the blood vessels in the body, that causes a lack of oxygen to be delivered, and the patients will experience pain. This can be triggered by a number of factors, sometimes cold weather, lack of sleep, um, any condition that can cause any disturbance to the patient can lead to a pain crisis. Most patients try to treat their pain crises at home. They use fluids, they take their medications, but some patients, they're not able to um, completely manage it at home. So they go to the emergency room. In the ER, they treat patients with fluids and pain medication. The biggest advice I can give to patients for when they go to the ER is to bring their medications with them, bring a letter from their doctor stating their diagnosis, stating what they normally take and what normally works for them in the ER, and also just to have an advocate with them to stay as calm as possible so that they can have the smoothest ER experience as they can.
Dr. Mensah, what treatment options are currently available?
We call them disease-modifying medications. The first one is hydroxyurea. Hydroxyurea is a medication that was FDA approved in the 90s. Hydroxyurea helps increase the amount of fetal or infant red blood cells in the circulation. These are red blood cells that contain a hemoglobin called fetal hemoglobin. Um, these red cells, they stay round, they don't sickle, and they are able to deliver oxygen more effectively than the sickle red blood cells. So patients on hydroxyurea helps raise the number of these fetal hemoglobin red blood cells. And by doing that, there's less sickled red blood cells in the circulation. And so patients have less pain crises, less ER visits, and less hospitalizations. The other medication is L-glutamine, which came in 2017. L-glutamine is a protein powder that's mixed with liquid. And by taking L-glutamine, usually in combination with hydroxyurea, it can also help decrease pain crises, hospitalizations, and ER visits. L-glutamine is also called Endori. That's the trade name for L-glutamine. L-glutamine is an amino acid or protein. The third medication is Oxbryta. Oxbryta is a hemoglobin modifier. And so within the red blood cell is a molecule called hemoglobin, and that's where oxygen sticks to. During a sickle cell crisis, the red blood cells, they change shape. And so Oxbryta, which is also called voxelotor, it sticks to the hemoglobin molecule and it stabilizes it. It prevents the red cell from sickling. By doing this, the red cells stay round and able to deliver oxygen better to the organs. Oxbryta was FDA approved to help improve anemia and reduce blood transfusions in sickle cell disease patients. And the last drug that was FDA approved is called Adakveo or crizanlizumab. This is an antibody against a molecule called P-selectin. P-selectins are molecules that help red cells stick to each other, stick to white blood cells, stick to the blood vessel wall. During a crisis, the red cells, they change shape, but then they stick to each other. And by sticking to each other and sticking to the blood vessel, they help block the blood vessel and prevent oxygen delivery. What Adakveo does, or crizanlizumab, it blocks those molecules so the red cells are able to move past each other and deliver oxygen more effectively to the organs. Adakveo was FDA approved because it was shown to reduce pain crisis, ER visits, and hospitalizations in sickle cell disease patients.
What about resources? Are there patient advocates or sickle cell organizations that people can go to for more information?
There are plenty of resources for patients and families to learn more about sickle cell disease. There is the Sickle Cell Thalassemia Patient Network. This is a local New York-based organization, and it has a lot of resources on sickle cell disease, sickle cell trait, and how to stay healthy and well. That is part of a larger organization, the Sickle Cell Disease Association of America. And this is a national organization that has many resources and videos about sickle cell disease and how to stay well. There's also the American Society of Hematology that has a large number of patient and provider resources. Almost every clinical trial for sickle cell disease um, gets published within the American Society of Hematology. And so that is a great resource. Also, the Center for Disease Control, the CDC, they have a lot of resources on sickle cell disease. And I want to point out to the American Society of Hematology, they have meetings that are open, and anybody, even a patient, a parent, anyone can attend these meetings to learn more about sickle cell disease.
And Dr. Mensah, what advice would you give to someone who's recently been diagnosed with sickle cell?
So the best advice I would give, I can give two pieces of advice. The number one advice I would say would be finding ways to de-stress and cope when you have times of stress. I think the biggest thing that I see with patients is when they're in a stressful situation, um, many patients, that stress can cause them to have a pain crisis and feel unwell. So finding ways to manage your stress and to um, withdraw in any way you can, whether it's, you know, um, you know, when you get angry or something occurs, to withdraw yourself from that situation, to getting rest, drinking water, limiting, turning off the music, stay in a quiet room, doing anything you can to de-stress. That would be my number one advice to patients. The second thing I would say is to see a doctor regularly and have a plan, an ER plan with your doctor. You need to have a doctor who knows you and knows you well, and knows you not just in times of crisis, like in the ER, but knows you at all times. When a doctor sees you when you're not in crisis and when you're in crisis, they appreciate it more, and they have a better understanding of, how it's affecting you and how it's affecting your life. And I can give one more piece of advice to patients, um, is to be as descriptive as you can about your pain and what you're going through. Um, the more articulate you are, the more the doctors can have an understanding of how it's affecting you. Unfortunately, pain is something that can't be measured. There's no lab test. There's no exam finding that really tells the doctor, oh, this person is going through a pain crisis. And so the doctors rely a lot on the communication that they get from the patient. So the more you can tell any doctor that you see and be as descriptive as possible, with as much information as possible about your medications and what you're going through, what you're dealing with, that will help the physicians take better care of you.
Great words of advice. Check out those websites. Thank you so very much, Dr. Mensah, for joining me and for this incredible information.
Thank you.